isometric exercises for knee arthritis. So I'm going to show you some isometric exercises. And what I mean by isometric exercises, these are exercises in which you hold a position, but there's no actual movement. These exercises can be used in cases where the knee joint is very painful after you reach a certain position that will prevent you from doing the traditional knee therapy exercises. So isometric exercises can be used as an addition to or in place of. And then when you start to get better and better the isometric exercises and your range of motion increases, then you can start to incorporate more and more of the traditional or dynamic exercise. This exercise is called a wall sit. So you stand with your back to a wall, rest your back on the wall, put the feet out in front of you, and you come down to a position just short of the pain. So let's just say for argument's sake, this was a pain-free position. The person would stay in this position with the back flat against the wall and hold for time. So this will be the wall sit. You may initially only be able to hold it for 5 seconds, but then as time goes along, you find you'll be able to hold it for 10, 15, 20, 30, even 1 minute. Hold for time. The legs begin to strain, maybe feel a bit of a burn, that's fine. Then you come out of it and you take a break. So that would be the wall sit. And with time, you would find that you'll be able to go lower and lower. So let's just say for the first week, this may be as low as you can go, but then as time goes by, you may find you can actually go a bit lower and hold it for more time, or even hold some weights in the hand to make the exercise more challenging. So the wall sit is a great way to start to exercise the legs and to protect the knee joint and treat arthritis. So in treating knee arthritis, you also need to treat the lower legs, the calves and the anterior tibialis. So to strengthen the calf muscles, you can do heel raises. Stand next to a wall for support. Then you can go up, you raise the heels, hold this position. Again, you build up more and more time as the weeks go by to get the calf stronger. Calf muscles are important in treating knee arthritis. Then you come down slowly. As you get stronger and stronger, yes, you can hold a weight in the hand or you can do it one leg. So you can do it with one leg, just cross the non-working leg across like this. And you come up and you hold for time. If getting up on one leg is a bit difficult, you can start with both legs and then you remove the other leg. Then hold this position. Again, hold it for time. Then start strengthening your calf muscles. This next exercise will strengthen the anterior tibialis. That's what the shin muscle, that's the muscle in front here. That's the muscle that does the anterior tibialis. So what you can do, you can stand against a wall, feet out in front of you, and you raise your toes up like this. And you hold it for time. And after a while, you begin to feel a bit of a burn on the side of your shin there as you begin to work the anterior tibialis muscle. And then you bring down slowly. For a bit of variety, what you can do, you can walk on the heels to also exercise the anterior tibialis, just to make it a bit more interesting. So you will walk on your heels, and then you would walk on your heels to exercise the anterior tibialis. You can move in different directions just to make it a bit interesting, so the exercise session is not boring. So doing this can also help to treat the anterior tibialis muscle. So this next one is called the leg extension with the ankle weight. So let's just say for argument's sake, if the knee was getting painful by the time you reach this position, obviously you cannot do the traditional leg extension like this, because then by the time the knee reaches here, it's very painful. You're not going to be able to get the knee all the way here. So what you can do, you bring the knee up to the point where it's just short of the painful position and just hold it right here. Just hold it right here. Okay? Contract the quadricep, hold the position, and then bring it back down. Okay, as time goes by, what you may find is that you can straighten the knee more and more, and your range of motion is going to increase. Hold the position, and down. Once again, as time goes by, you might find yourself now being able to get the full range. Hold the position for time, and gently come down. Okay, so take your time, gradually build up your range of motion. So again, initially you might only be able to get this high, and that is fine. hold the position as an isometric contraction that's going to start to strengthen the quadricep muscles. And with time, as they get stronger and stronger, and the knee gets more and more stable, the range of motion may very well increase. Leg curl with the ankle weight. So this will be the reverse of the leg extension. So you stand up, you have the ankle weight there, stand next to a wall for support. Now you bend the knee, and let's just say your knee was getting painful by the time you reach this point. What you will do, you will lift the knee just short of that point and now hold that position. And you're going to isometrically contract the hamstring muscle to gradually build the strength of the hamstring muscle over time. And again, as time goes by and you keep doing your knee therapy, what you may find is that now you can go higher and higher and higher with less and less pain. Okay, but the principle here is using the isometric contraction, which means holding the joint in position, no actual movement, but you're contracting the muscle. That is actually going to help to build strength over time. Now we're going to do our lying isometric knee extension. So in this case, you will lie on the bed and you will take a pillow or bolster, put it under the knee, like this here. You lie down. Okay, and then what you can do 1 or 2 knees at a time. Same time, it doesn't matter. So you pull both feet back, then you extend like this, provided this is a pain-free position for you, and you really contract the quad muscles. Hold it for time, and then gently come back down. Okay, you can have the phone on, put on some music in the meantime, just to make the time go a bit faster. So once again, pull the feet back, slowly come up, tighten up the quad muscles, tighten the quad muscles. Let the time build. First, you may only be able to go for 20 seconds, then 30 seconds, then work your way up to a minute. You can also add ankle weights on the ankles to make it a bit more challenging if you have them. And then you're back down. Now we're going to do the reverse, which would be the knee flex. In this case, we are going to press the heels into the bed. So again, you press the heels into the bed. That's going to tighten up the hamstrings here. Keep the back flat. Really push the heels into the bed. Pull the feet back and relax. Take a break about 30 seconds to a minute. Again, pull the feet back. Really push the heels into the bed. Go for time. Build the time up as the weeks go by. And relax. Okay, so that's isometric knee exercises that you can do when you're lying down on the bed. Exercise is called the isometric leg press. You can use a blanket, a belt, a bed sheet. I'm going to use a stretching strap in this case here. Okay, so you're going to need to have strong arms for this one. If you're having any shoulder issues or any joint or any wrist issues, this may not be for you. But once there are no problems with the shoulders and the arms, you can do this exercise. So you come on the bed here, you loop, you strap around the foot. Okay, lie down. Again, you bend the knee to the point where it's comfortable. You don't want to go into the pain zone. So let's just say the pain zone for me would be, let's say it was here. I will stop just short right here. I will hold the stretching strap, and now I will press against the stretching strap with my leg. Okay, so now you can appreciate why it is you need to have arms with no problems before you do this exercise. When you press against the strap, it's an isometric contraction. This is going to exercise the glutes, the hamstrings, and the quadricep muscles in one. Hold for time and relax. Bring it down, easy. At the end of the isometric exercise session, you can do this one last exercise. This will be the leg swing. This is not an isometric exercise, but it is a very good exercise to help retain mobility in the knee joint. So what you do, you sit at the edge of the bed with the feet off the floor and do some gentle leg swings like this here. Okay, do this for about a couple minutes. Again, you can put on the phone, have a movie playing or some music playing just to make it pass a bit faster. Alternatively, what you can do, you can also add some ankle weights around the ankles. Maybe that's a 2-pound ankle weight and do some leg swings. Okay, so I hope you enjoyed those exercises, those isometric exercises for knee arthritis. If you have any questions, you want us to review your x-rays, you can call or WhatsApp us at 747-5297. We are located at number 4 Chincuna Gardens in Chinchin Road, Cunupia.